Microneedling is a very interesting procedure. It can be done in many ways with fine needles inserted into the face. Usually when you talk about microneedling, you're talking about multiple needles going superficially into the skin and down into the dermis. And this is a technique which I actually started or brought to the United States in the early 1990s. And initially people thought it was barbaric, putting needles into the face. And it took a long time before America caught on. It's probably now the most common procedure performed by estheticians. But what microneedling offers to the patients is skin rejuvenation. It builds up collagen. So it's called also collagen induction therapy. So we've been doing it for over 25 years in our practice, always getting results. It softens wrinkles around the mouth. It helps with scarring from acne. It can improve scars. It can also create tightening. Today, microneedling is combined with radiofrequency heat energy. So needles are inserted into the skin, which are heated through a radiofrequency generating box, which actually heats up the needles, so you get a double, you get improvement in the skin based on injury from needles, which create little tiny micro defects in the skin to fill up with collagen. In addition, the heat that's injected into the skin also creates collagen buildup. So one gets a lot of collagen buildup, which both have the effects of reducing wrinkles and scarring, but also causing a tightening in the face and even in the neck area. Microneedling can be used anywhere in the body. It can be used in the abdomen, can be used on the arms for skin tightening and for smoothening of the skin because collagen is built up. So microneedling has come of age, and we are very active in our office with microneedling. We have multiple different machines which perform this technique. Our estheticians do it, the doctors do it, and the results can be quite amazing. So possibly everybody is a candidate for microneedling once they start in their 20s. Young people with acne scarring can all have improvement. You can even start in their teens with acne scarring to get improvement in the scarring. The other thing is microneedling can be preventative. So as soon as one's starting to develop wrinkling of the skin, if one can do home microneedling, one can do microneedling with estheticians or nurses in the office. Doing microneedling on a regular basis just keeps building up the collagen and prevents wrinkling and breakdown of the skin occurring. The other advantage of microneedling is that it opens up pores in the skin and allows topical treatments to enter into the skin at the same time. So one can get a double whammy by using various topical treatments such as using the antioxidants, the growth hormones, and the various peptides in these skin creams, which can enter the skin and then penetrate better and have better effect. So microneedling, because it's a fractionated treatment, what happens is that there's columns of skin which are not injured by the needles, which allow healing to occur rapidly. So it's very difficult to get scarring in the skin or loss of pigmentation, as opposed to an ablative dermabraiding type procedure. So this is the big advantage of microneedling. The chances of you getting scarring or any adverse changes in the skin are extremely unlikely. As long as one doesn't over microneedling, if one keeps microneedling in one area over and over, it will become like an abrasion. So this happens extremely rarely, and that's why microneedling is very safe and very effective.